Well, good morning. I really want to thank everyone for being here this morning for this exciting announcement. I have some of our healthcare advocates with us today and organizations, and I just want to thank everyone for your vision and your leadership on really fostering this key piece of legislation. The General Assembly has a great responsibility for public health, and we need to really ask ourselves, what can we do to improve population health and meet the healthcare needs of our citizens? This is our responsibility as elected officials. The state's current course is not working. Despite already leading the nation in Medicaid enrollment, we raised eligibility again in 2014, granting over a third of Kentuckians access to Medicaid. The Commonwealth, unfortunately, continues to rank near the bottom nationally in many health metrics. This includes diabetes, cancer, heart disease. More than half of Kentucky's 120 counties are located in what's called the diabetes belt, and this means that over 11% of individuals in those counties have been diagnosed with type 2 diabetes. Most of all, aside from the advances in modern medicine and billions of dollars invested, socioeconomic disparities and health insecurities continue to be prevalent in many of our counties. Having health care insurance and coverage doesn't always equate to access to care. It doesn't automatically connect individuals to those important health screenings like cancer screenings, chronic disease exams, and so forth. COVID has really jolted our perspective. It's jolted our perspective on healthcare delivery and our abilities really to transform the healthcare that we need. So now is the time to start tackling our most pressing healthcare issues. We can do this focusing on new ways to help Kentuckians overcome the barriers hindering them from living a healthier and better life. This is why this measure is so important. We are innovating and leveraging Medicaid's role as a tool to improve the health of our population, targeting Medicaid on programs that we know work. I'm proud to stand here with you today, and we'll file this legislation later on. Put simply, this legislation expands community health worker programs statewide with the goal of creating a system of navigators who help improve access to care. They are our frontline healthcare workers with a uniquely close relationship with the community and a deep understanding of the community that they serve. These health professionals, who we have many with us today, thank you for being with us, work in our medically underserved communities. They connect individuals with social services available and healthcare resources. Community health workers work in rural health clinics and primary care offices, local health departments, and other nonprofits, and even dental offices. The list is really endless. What makes community health workers unique is not that they are necessarily clinical professionals, rather they are the point guard in guiding local grassroots efforts and helping individuals understand what resources are available. They provide informal education and sometimes even formal education. Some of our community health workers can be seen as diabetes educators. And so they are a critical and integral part of our healthcare system. Community health workers encourage individual responsibility for health, to live healthier lifestyles, and improving overall quality of life. Community health workers, again, are educators, connectors, and facilitators. Over the past few years, we've seen how these types of support services and programs are more interconnected than ever. We know that this will help Kentucky be more targeted with our Medicaid dollars, which account for a significant portion of our state's budget. The Kentucky Home Place study in Eastern Kentucky showed that investing in community health worker services has it really brings a significant return on investment. Every $1 spent in Medicaid dollars saves more than 11 Medicaid dollars in providing medication and services. On the healthcare worker shortage, we are all very aware, and this was especially highlighted during COVID, that we have a real healthcare worker shortage. There is a well-documented need for healthcare career pathways, and with this, we hope to expand that talent pipeline. My proposal will create a classification for community health workers and expand certification through KCTCS, our Kentucky Community and Technical College system, and increase the number of healthcare workers in Kentucky. Strengthening our behavioral health support system is also critical for the future of Kentucky. Community health workers are trained to understand the importance of social determinants of health, finding the right outlet for engaging people who may be hesitant about their health care or are possibly unable to access their health care for a variety of reasons. So we must continue meeting folks where they are with individuals they know and trust. This is a step toward better health in Kentucky. It creates a seamless process that improves social determinants and negative behaviors in health. The Bluegrass State can change its downward trajectory of systemic health issues. My goal is to create a statewide system of navigation, improving access to our healthcare system, all of the resources that we've put in place, and improving Kentucky's overall health. We do have some special guests with us this morning. We have many of our frontline workers, and I really want to thank you for the work you do, and thank you for being here with us today. We also have with us Emily Beauregard from the Kentucky Voices for Health, and you all can come on up. And we also have a special guest, an actual community health worker who I will invite to say a few words.
Well, thank you very much, Representative Moser, for inviting us to be here today. We are just thrilled to be here talking with you all about the value of community health workers. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health. I'm here with Christina Libby, a community health worker from the Homeless and Housing Coalition of Kentucky. We have worked for years, since about 2014, to really build our network of community health workers in Kentucky because we have seen just how valuable they are in the lives of Kentuckians. Our healthcare system, we all know, is incredibly fragmented. It's too complicated, it's hard to navigate, it's hard to understand your treatment plan, how to get the care that you need. Community health workers are there as trusted people in your community who you probably know as your neighbors. And they can help you navigate the system. They can simplify the process for you, connect you with a provider, explain your treatment plan, and make sure that you're really getting the care that you need to improve your health. And beyond that, community health workers assist people with their basic needs. We know that you don't just need health care to be healthy. You need quality housing. You need healthy food. And so transportation is another service that too many Kentuckians really see as a barrier to getting the care that they need. And community health workers are there to help you navigate that, get services, and really find ways of improving your health and well-being. And so I wanted Christina to have a chance to talk about the difference that she's able to make in people's lives as a community health worker.
My name is Christina Libby. I'm a community health worker, and it's hard to say specifically what I do day to day because it's a lot of what Emily and Representative Moser were saying is it's connecting people to the services that a lot of times they have access to, but they aren't sure exactly how to connect those points between being at home and getting into the doctor's office, or even understanding that while they have Medicaid, because thankfully we have expanded it so that so many more people have access to the health coverage that they so desperately need, they have that card in their wallet, but then they get sick and they're not sure exactly what the next step is. Or oftentimes, I don't know if anyone else has ever gotten a letter from an insurance company and you look at it and you haven't the slightest idea what it means. You don't know if you're supposed to pay something, you don't know if you're supposed to send in a form. And that's honestly one of the things that I do pretty often for some of our clients is I'll get a phone call and they'll say, I got this letter and I don't know what it means. And I'll say, take a picture of it, send it to me, or I'll go to their house, I'll read it to them. And most of the time it's, you can put that in the recycling, you're all good, you don't need to do anything. But every now and then it's something that I can help connect them to a service that they didn't even know that they were eligible for. Oftentimes we're translators, we're tour guides, we are the link to get people to the services that they thankfully have access to, they just need help actually getting to. And so I really appreciate this bill and hopefully being able to pay a lot of our community health workers for work that they've been doing for years. This is oftentimes a person in your community that is already doing this work, and now they actually can get paid for that work that they're doing. So thank you so much.
Thank you so much for being here. Thank you, Christina. And next we have Dr. Chris Williams with KCTCS here to talk a little bit about the healthcare worker shortage and their partnership on this legislation in really creating a healthcare pipeline, a healthcare worker pipeline, providing college credit for the certification that the community health workers receive. So thank you, Dr. Williams.
Thank you, Representative Moser. It's a real pleasure to be here today on behalf of the 16 colleges of the Kentucky Community and Technical College System. The skilled talent healthcare pipeline is really important to us. We're one of the largest providers of the up to 2-year certifications required in the field. We have really strong partnerships with our state representatives like you, but also with our healthcare providers and with the cabinets that do this critical work and support healthcare. And so it's a privilege today to be here to be part of this recognition, as was noted, of this really important part and member of the healthcare team. Each of us have probably had that moment in a hospital when we're scared, we're worried, and we're pretty clueless about what comes next, and that one person comes up and serves as that navigator or as that carer who grounds us in the process. And so to be part of the education provider network for that position is really important to us. We're very excited about the opportunities that this bill will bring forward, and it's a real honor to partner with Representative Moser on this. Thank you.
Thank you. Okay, well, thank you all. I'm happy to take any questions. Okay.
So, can you explain how this is different from SB 10 sponsored by Robin Mills?
I Senate Bill 10. So tell me about that bill. So while we're... Oh, well, I am not entirely familiar with that bill, but I believe that that is looking to, I don't know if that's a loan forgiveness program or a way to increase the nurses, certainly in Kentucky. We have a healthcare worker shortage across the board, and this is specific to community health workers, but certainly we are looking at other legislation, putting a framework in place to increase our availability and training of healthcare workers. So, and that would be from physicians, nurses, APRNs, to dentists and so forth, counselors. So that's another initiative. So. Sorry, I'm not as familiar as I maybe need to be. I will be. We're focused on the House bills right now. So, okay.
When this will be in committee?
I anticipate not today, but probably next week. Mm-hmm.
What impact will this have on Northern Kentuckians, specifically like your region?
Well, I think it's important that we focus on all areas of underserved, the underserved population in Kentucky, and certainly there are underserved areas in northern Kentucky as well. And it really creates, again, this system of navigators. And so there are federally qualified health clinics that community health workers can work in, community mental health centers, primary care offices. the list is long as to where the community health workers can work. So it really depends on the need. Probably the individual providers will decide whether or not they want to hire a community health worker. So. Okay. Well, thank you all. Is there anyone else? Nope. Okay. Thank you very much for your attention, and thank you for your support, all of you. Thanks for being here.